Good morning and welcome to Health Rapp. Dr. Maria Rapp, Dr. Jeff Rapp here with you from the Chiropractic Wellness Center. Our web address is www.rappwellness.com, and our physical location there is at 1130 East Cloud Street here in Salina. That's at About Cloudern, Ohio, directly south across the street from the Dillon's grocery store parking lot. Today joining us is Danelle Johnson from Medical Thermography, Kansas. And we have a lot of really good information that may be new to some of our listeners. Welcome, Danelle. This is one of the businesses that is in our building there at 1130 East Cloud. We have a few different healthcare-oriented businesses there. And today we're going to be talking about thermography. So, Dr. Maria and Danelle, what exactly is thermography?
Well, some of you may have remembered back, 5-6 years ago, I was doing some thermography through btiscan.com, which is the national organization. And of course, chiropractors use thermography. Simply put, thermography is checking for inflammation. It's a camera that detects heat, which can tell inflammation. So at its base, that's what thermography is. So how are you using it in your business, Danelle?
Well, thanks for having me. So we are using thermography at our business to help people pick up the heat signatures in their body, because heat is a precursor to everything going on in the body, either heat or lack of heat. So very detailed, specific heat signatures let us know what's going on in the body, such as adjunctive breast health, breast screenings, thyroid, neuromuscular, vascular. Thermography can help to detect a host of things that's happening in the body and become a really great tool to use with your practitioner in your health and wellness.
And even in dental, I've worked with some dentists too who look at inflammation, and you can see where that inflammation drains straight down into the lymphatic system. And you need to understand that inflammation is normal. It's a normal response of the body. What's not normal is if the inflammation remains for long periods of time. So that's what we're looking at with thermography, is there's inflammation there. Why? Okay, that's what we want to know. Let's figure out why. And with the spine, of course, we have some problems with joints that can create inflammation. If we can make changes there, we can get rid of the inflammation. So what other areas are you looking for inflammation in the body?
So inflammation can be seen in the head, in the brain, in the sinuses, in the ears, down into the dental area. And then, just as you mentioned, the dental area drains into the lymphatic area, which actually happens to be one of the highest causes of breast cancer, is dental inflammation draining into the lymph, which then drains right into the breast. But also, some of the things that we look for is a lack of heat. So a lack of heat, as being a chiropractor, means that the blood is not flowing to parts of the body. So there are conditions of the body such as MS or where
nerve problems,
nerve issues, where the blood is not flowing. Sometimes in thermography, we'll do an imaging session where there is no blood flow to the feet or the hands, or it might be just on one side of the body, which is tells you that there's a neuro issue going on there with the brain. So it's really helpful to see where blood is flowing and where blood is not flowing and where this heat is. Other things such as skin cancers and thyroid issues. The professional thermography doctors are very skilled at knowing when blood is present and what the patterns look like. They look for patterns in the body, and they utilize that to help give you diagnostics to determine. We do want to mention that it's a great tool for adjunctive breast screening. It can see things that are happening at the earliest stages to help people do something about it. And it's a great tool to then go on and have other adjunctive screenings done.
And as you said, the patterns, we want to see the patterns changing. Inflammation may be here, but it should be gone after a while. So when you get your first scan, you follow up in 3 months, first of all, because you want to establish a baseline. So the same as pretty much with mammography, you kind of get a baseline. And then also the same as when you get a mammography. If you find something unusual on the scan or see this pattern, then you get another study done. You know, with a mammogram, if something shows up, you go get an ultrasound. With the thermography, if something looks suspicious, you go get an ultrasound. So it's the same thing. But talk a little bit about the camera that's used.
So the camera has been used in medical work for many, many years, actually dating back to the 1960s. Breast work was done with thermography, and it was actually FDA approved in 1985, I believe it is, by the FDA for adjunctive breast cancer screening. So this camera is state of the art. It is thousands and thousands of dollars, but it is very detailed, very, very detailed.
And military grade, so it's very sensitive. Nothing touches you. It's like standing in front of a camera taking a picture. So nobody sees you, nobody touches you, no compression, no radiation. It's just simply checking temperature of your skin.
Very non-invasive, right?
Exactly. Extraordinarily non-invasive, but gives lots of great information.
Great information is what we want to provide you here on our show, obviously. And again, we're here with Danelle Johnson from Medical Thermography, Kansas. And of course, right next to her, the lovely and talented Dr. Maria Rapp. We are from the Chiropractic Wellness Center here in Salina. And Medical Thermography, Kansas actually has a small office in our building, a very nice small office. So that's why we wanted to try to help them out and give you guys some more information. So join us in 2 minutes. We'll be back with more Health Rapp. 2005, and so hopefully you've been with us for most of that time. But today here from the Chiropractic Wellness Center, myself, Dr. Jeff Rapp, and then Dr. Maria Rapp, and also from Medical Thermography, Kansas, it's Danelle Johnson. And so the topic of our show today is going to be medical thermography and all the various aspects of that. And one thing I was sort of curious about, Dr. Maria and Danelle, is who exactly should get a thermography scan?
Well, the really neat thing about thermography is it's actually safe for any age, absolutely any age, even pregnant and nursing mamas, which is a great tool for them. But the people that we would most recommend it for is yearly screenings for breast health. So if you fall into that category, it's great for you. But also if you're a person that has something going on that you don't have answers for and you would like to get answers for, it gives you a very detailed explanation of things that are going on in your body that you can then correlate with your practitioner to see what those things are that's going. So if you have nerve issues, if you have circulation issues, if you are experiencing something going on in your breast, whether it be tenderness, itchiness, scaliness, pain, anything that's just out of the ordinary for your breast, you'd be a perfect candidate for that. Also, pain. If you have pain in the body, pain usually comes from inflammation or a spine issue going on, so you would be also a good candidate for that. Even digestive issues, or if you just need answers to some health problems, you would definitely be a good candidate.
And I always recommended younger women, especially if you're wanting to do some preventive or some monitoring of breast health. You're not even generally recommended to have a mammography until your 40s. So a lot of the aggressive problems happen in 20s and 30s. So why not do something that you can check something in there and be monitoring it to make sure nothing's going in the wrong direction. But you do several types of scans. So what scans do you offer?
So we do offer just the breast area. Then we do offer more of like a torso, which is waistline up through the head. And then we also offer a full body. And many times the full body gives a big picture, a very complete picture of what is going on. Because as you know, the body really works in conjunction. So we do have 3 different types. And one thing that people are surprised about is how quickly thermography is. It's pretty simple to do. Nothing touches you. You don't touch anything else. We're usually done in about 30 minutes. You do have a little period of acclimation. So, when your shirts touch you, you have heat. So we do have a little period of acclimation where we want your body temperatures to get normal, but it's rather an easy, painless process to do. And then your imaging is sent off and it is looked at by 3 expert thermography doctors. So 3 doctors look at your imaging, and then that imaging is sent directly to you, and then you do get a follow-up consult with an expert thermography doctor as well, which that's something new that we're doing now. And so really you're getting 3 different consults. The doctor, one with me prior and then one with me after, which I had to go through elaborate schooling to be trained in this, and so the training is quite extensive, and we've learned a lot, and we're excited to bring this back to the Salina area.
Well, I do want to mention that there are some facilities in the bigger cities that offer thermography, but their cameras are not as good a quality. This is just top of the line camera in sensitivity and also in the images. You don't only get a rainbow image, you get what's called an inverse gray image, and so that really shows a lot of different types of issues as well. And I also want to mention that men can come in and get this.
That's very true. So actually men even have breast situations going on. Correct. Which have to do with hormones, and so that's something that we rarely see in our regular doctoring wellness work. Mm-hmm. And so it does show up. But if you're a man and you're experiencing pain and you would like relief for your pain, the best thing to find out is, where is this pain coming from? Like, what's the root cause of the pain? And then what can we help you to do about it? So one of the greatest things about thermography is it gives you answers and points you in a direction so that you can get on your path to wellness, better wellness.
Correct. And there's the great way to deal with your health is to prevent problems. Just like I always say on this show, people take better care of the cars than they do their bodies, because if a light comes on, you look and see why that light came on. You don't just say, oh, that's annoying, and cover up the light. So as humans, we tend to discount any aches and pains. I'm just getting old. I just didn't get enough sleep, blah, blah, blah. But there are a lot of things that can show up as pain conditions or just something weird. I always trust your intuition, and especially a mother's intuition. There's just something not right. I say, go check it out. Check it out. And this is a great way of doing it without doing harm. In my eyes, a screening should not be harmful. And so this has 0 harm involved and can get you some great information. It's not something that gives a treatment, but you'll get some information on what to do next if something does show up.
Well, and what you said there about the light coming on in the car, with thermography, this is going to help you so that you don't get to a place where the light comes on in the body. And the light doesn't come on, but what happens is we end up with a health emergency. Mm-hmm. And our goal is to help people not get to the health emergencies, but have, a chance. And we do have something that people ask me a lot about is the cost. There is a way to get $150 stipend for this through the United Breast Cancer Foundation. So that's something that we should talk about.
Well, they know it helps and can help save them money.
Well, it's been a tremendous amount of information here, and these 2 ladies are just chock full of great things, and we hope that we can bring greater health and maybe preventative health, and maybe preventing something that can be more easily solved quicker or earlier on in life.
Yeah.
And that's exactly why we're here and why we're doing this show today. So we are going to be up against a break here coming up. So again, Chiropractic Wellness Center, www.rappwellness.com and btiscan.com. We'll be back in 2 minutes for more Health Rapp. Welcome back to Health Rapp. Dr. Maria Rapp, Dr. Jeff Rapp here with you from the Chiropractic Wellness Center, and also Danelle Johnson from Medical Thermography, Kansas. You can check out btiscan.com for a lot of information general information, that is, about medical thermography.
And that's the nationwide.
That is the nationwide.
Breast Thermography International.
Exactly. So I guess the biggest question that I have, and some of our listeners might have, is how does this work? What does it take, and how do you actually, what happens to get a thermography scan, and how can you get scheduled for one?
Starting with making an appointment. What do you do?
So I'm going to give you a phone number, 785-260-0022. So today, if you're interested, thinking, wow, this is really something I want to look into, text us at that number and we will send you a detailed document with all the information and links to how you can schedule and pricing. So as of today, that's a great way to reach us here at Medical Thermography Kansas. But we do have a couple of links that people go through. You basically schedule your time, which we schedule 1 hour time blocks, but you're usually done and out of there between 30 and 45 minutes, depending on what size of a package that you want to do. And then once you come into the office, or actually after you schedule, you fill out an intake form that goes through some questions about your health, some things that you do or don't do, things that have happened to you in your past, medications that you take, because all that information helps us to know what's going on in your life, and so we can give you a very detailed report back based on your health history. And then you a week prior to your appointment, there are some things like no surgeries, because if you were to have a surgery, that's going to create inflammation in that area. So there are a few things that we do look at that way. And then 48 hours to 24 hours before your appointment, you don't want to be out in the sun getting a sunburn, because obviously that's going to show up as heat. And now that we're in the summer, that's important. In the winter, that's not as much. And then 24 hours prior, there's some things that we look at as well. And then you come in the morning of your session or afternoon, and you will be there for a few minutes, like I said, acclimating, and then I will come into the room and we do an imaging session. You're behind a screen, the camera is there, but you do have some nice privacy. And then we do an imaging session. It doesn't take that long, and we send that imaging off to the thermographic doctors who do look at that.
Well, and you do disrobe, and so depending on which scans you're getting, you may just disrobe from the waist up, or you may be completely disrobed. But as Danelle said, nobody's in there with you, so you're on your own. The acclimation period just helps your skin balance out. If you've been really hot outside and then you come into air condition, your body needs about 15 minutes to acclimate to that, and then taking the clothes off, wherever that was rubbing, could have created a little inflammation. So we're really trying to get things balanced out to the environment before the scan is done. And that was one of the hardest things, I think, when I was doing them, is having them waiting for 15 minutes. Don't scratch. And as soon as you say don't scratch, what happens? Everything itches.
Well, as a woman who has done mammography, and I always think of this as a gift to your family. Mm-hmm. So when I'm standing there acclimating, I always think of, I want to be around until I'm 100. And my daughter teases with me, you're going to live past 100 and bother me still. And so I always think about those things. It's like, I'm doing this for my family. So as you're standing there acclimating, I always think it's a power pose. So just be proud that you're doing this and taking charge of your health. Like, it's a good feeling to know you're doing something proactively.
Right. And also share this with your family and friends. This is something that we want to get the word out, because there's not much available in our state. So we're very fortunate to have here in Salina, and people have come from hours away, especially from western Kansas, because there's nothing else available. And coming in for a scan, we start with your original, and then 3 months, and then about every 6 months. Is that what they're recommending?
It really does depend on what we find. The really neat thing is, once you have a baseline, that is just like magical, because that baseline then tells us changes. And it's those changes that are important for down the road. But I did want to mention, I have friends in all states that are, interested in health and wellness, and there are some states that don't even offer this. So we are very fortunate here in Kansas that we can offer this, and we're not even in eastern Kansas, we're in central Kansas. So having this technology here we're really lucky to have this.
And when you're having the scan done, as Danelle said, you're behind a screen, a curtain, and you're just assuming different positions. So you get in positions that are best going to check the different angles of the breast or head or neck or back, whatever we're scanning. So you'll be getting into different positions, which she goes over before you disrobe and then talks you through.
What are some of the things that you've seen in your own personal experience with this, or maybe other experiences with thermography that you've heard about that have picked things up, maybe that sort of averted disaster?
Probably one of the biggest ones is how the decay from our mouths starts to creep into our lymphatic system and then into the breasts. So we can see that right away on thermography, but the really neat thing is that we can help women change that. Mm-hmm. So before that leaks down into the lymphatics and into the breast, if we start seeing that happen, there are things that can be done to change that. So that's the really exciting piece. We do see that a lot. Another one is women's hormones. You can step in front of the infrared camera, and if you have estrogen dominance is noticeable right away. The thing about estrogen dominance is you maybe have heard that word come up when someone says, I have cancer and it's estrogen dominant. Well, cancer tends to feed off of estrogen, and we do not want excess amounts of estrogen in our body. So being able to change that is a really special thing.
When the report goes over everything that is found, and then you go over some ideas for them to work on.
Correct. The report gives us lots of details of what we can do to change what's going on.
And then you'll be able to monitor that and get another. You can do as many of these as you want. You can do one every day, and it's not going to do any harm.
And it is adjunctive. It's not meant to take the place of any other type of diagnostic procedure whatsoever. And it is not to treat or to cure or to prevent any type of specific disease. It's a screening. So,
but it's something good to do and does no harm.
Well, Danelle, thank you so much for being with us today.
Thank you.
Again, that's Medical Thermography Kansas. You can check out btiscan.com. And you know what, Dr. Maria, we are out of time on this Saturday morning.
Yes, we are, Jeff, and that's a wrap.
A health wrap, that is.